broadcast will give an unprecedented look at how two nurse managers led a deliberate design and implementation of a new policy. Our cameras captured the event that motivated the managers to become change agents. Let's take a look.
Hi, Miss Clark. This is Paula. She's going to be your nurse for tonight.
Hi.
So,
Hi.
Paula, this is Miss Clark. She is she has bowel obstruction. She haven't had any bowel movement in the past 2 days, and she is going to be NPO. She's requiring a CAT scan for tomorrow.
Are you confused?
What is bowel obstruction? What is NPO?
Well, bowel obstruction is you have something going on in your intestine that we're trying to figure out what's going on. So NPO means that you're gonna have to, you can't have anything to eat or drink for the next
phase. We find that we need to identify what it is the change we want to implement. We're going to collect the data that we need, whether it's for the things that are going to benefit this change, or how bad is the situation that we want to change. We are going to identify the agents of change. In this case, the change agent is going to be management.
We'll take good care of you.
Okay.
Okay, have a good shift, Paula.
Hi. Again, my name is Paula, and I'm going to write my name up here on the board. My number is 4737, and your PCA is going to be Brian.
Going on. The nurse was saying I have something called like bowel production and GTO for 12 hours. I really don't know what's going on. Okay, you'd like to talk to the nurse? Okay, hold on. Call like.
Hi, you called?
Yes, my mom wants to talk to you. She doesn't know what you guys are talking about. My medical diagnosis.
Okay, so you're gonna let me talk to my mom?
Yes.
Your mom?
Mm-hmm.
Okay. Hi, this is Paula Hernandez. I'm a nurse for Miss Clark today. How can I help you? No, it's not about production. It's about obstruction. There's something wrong with her bowels, and it's kind of a blockage. No, they're not gonna give her GTO car. It's actually that she can't be eating or drinking for 12 hours. So that's why we're not giving her any water or any ice. And I'll go ahead and reteach that again to her.
Okay, so what is our desired change? Well, what we want to do is we want to enhance nurse teaching and improve nurse-patient communication. We're going to do this with the introduction of our Give Help communication tool. The Give Help tool will be given and discussed with the patient at the beginning of each nurse's shift. Now let's talk about the importance of this tool. Why is it important? Well, we want to provide patient-centered care. This means that we're going to share information with the patient. We're going to encourage participation and collaboration while promoting autonomy. This tool is also aimed at decreasing errors. We also want to improve outcomes. And when I say that, I mean increase patient satisfactions, compliance, and also quality of care.
Incorporate this tool to the care we already provide is because it's not something new. It's actually something we do every day. The reason we wanted to name it Give Help is because we already are doing things like giving bedside report. We're already involving the patient in every interaction. We already validate the fears and concerns. We already emphasize our commitment to their health. But do we do it consistently, and do we do it every time? Also, it is our patient's right to have humane, compassionate care given to them. It's also their right to have an explanation of their care, including their medications, their procedures. It is their right to know when all of these events are happening. Also, it is their right to be listened to. This is a great opportunity to hear feedback from our patients and their concerns in regards to their care. This tool allows them to be active participants. This is why we wanted to name it Give Help Tool.
So let's talk about our Give Help communication tool. We have developed a communication form that will be given to the patients at the beginning of their admissions and at the beginning of each nurse's shift. Of course, this tool will be tailored in accordance to the need of each department. This tool will address basic questions about the hospital stay and will allow the patient time to process the information. It will reduce their anxiety about procedures and keep them informed. Overall, this form is intended to reinforce patient understanding, not to substitute nurse teaching. So here's our Give Help communication tool, as I stated earlier. We want to include things such as, why am I hospitalized? What am I being treated for? A lot of people don't know what treatment they're actually receiving. Who are my doctors and what are they seeing me for? The diagnosis and a short description of what it means. Medications and how they're helping me includes their scheduling. What procedures, labs will I have done and at what time? Also, we're going to leave room for questions. The patient can go ahead and think about anything and then generate questions for the nurse at a later time.
We're going to discuss Lewin change theory. In Lewin's change theory, there are different facets, and the first phase that we're going to be dealing with is the unfreezing. In the unfreezing phase, we find that we need to identify what it is the change we want to implement. We're going to collect the data that we need, whether it's for the things that are going to benefit this change, or how bad is the situation that we want to change. We are going to identify the agents of change. In this case, the change agent is going to be management. And the change target is going to be the staff nurse. The staff nurse is going to be dealing with the change and put it into practice. If change is to happen according to Lewis, we are going to need to increase the strength of the driving forces, or we are going to need to weaken the restraining forces. In the next slide, we're going to walk you through the analysis of these forces. Next, we will discuss the force field analysis. The first thing we're going to address is the driving forces for this change to happen. Number one thing we want to do is decrease sentinel events. The Joint Commission has found repeatedly, and this one particular study showed that 70% of all sentinel events were related to communication problems. The second thing we want to do is decrease errors. $29 billion are spent in medical errors. The third thing we want to do is to increase patient satisfaction. We know that when patients are informed, involved in their care, they're going to be more satisfied. And at the same time, by increasing patient satisfaction, the next thing we want to do is to increase the refund that the hospital will receive by having good scores in the HCAHPS every year with the patient surveys. The next thing we want to do is increase patient compliance. How do we want to increase patient compliance? It's by the same philosophy, keeping them informed, keeping them involved with what is happening to them, what medications they're receiving, what treatments are going to happen, when those treatments are going to happen. If patients are compliant, we're going to be able to decrease the losses due to the rehospitalization of these patients. Often, if these patients return within 30 days of the last stay at the hospital, we will not be able to get reimbursed by that hospital stay. At the same time, we would like to increase patient-centered care. It's kind of a repetition of what we've been talking about, but we cannot stress enough that when patients are informed, involved, they will take ownership of their care, they will understand the instructions once they go home, and they will continue on their treatment when they go home. We only have patients in the hospital for a very short time, and it's important that we use every single minute that we can to help them be successful after they leave. Last, we want to increase the staff accountability. By the way of keeping the records updated, we can give the patients updated information. Every single time we have to print this tool, we need to make sure that everything is current and the patient is getting the latest information. Next, Bernardo will introduce us to the restraining forces.
Thank you, Mita. Now we're going to be discussing the restraining forces. I guess one of the biggest restraining forces is going to be staff assistance. We're looking at staff complaining about maybe time-consuming or extra work. Now, is this time-consuming? This form will be automatically generated by the system, and when the nurse prints out their shift report, it will automatically print. So there's absolutely no extra work for the nurse. What about creating extra work? No, it's the nurse's responsibility to introduce themselves and answer any questions at the beginning of every shift in the first place. This tool is definitely not intended to replace nurse teaching. It is to enhance the teaching. Let's talk about cost. How expensive will this tool be? Well, we've averaged out several prices, and we found that on average it will cost about $3,125 to implement this tool into the systems. That's about $125 for roughly about 25 hours of work. Another concern is how accurate is this information, and how can we hold other healthcare professionals accountable? This patient communication tool will actually increase accountability of all healthcare professionals by serving as a tracking system. Both nurses and doctors will be prompted with the option to report if the medical records are not up to date. Thus, tracking the health professional's performance and giving the nurse the power to advocate for the patient. This is going to happen during the admissions process and at the beginning of every nurse's shift. The nurse will have to complete all documentations and charting before beginning the next shift in order for the form to be up to date. The nurses will be able to select not updated option, and administration will be able to keep a track of the doctors and other nurses' performance. This will be an incentive for all to keep their patient charting current. The communication tool will promote nurse-patient communication. Now that we've discussed the unfreezing portion of our project, we're going to move on to the movement stage. We took a normative re-educative strategy approach. First, what we're going to do is we're going to start with a pilot program for a unit that has the highest amount of errors. The ideal unit would be an ortho-floor or a med-surg unit. We're going to ask all the nurses in the entire unit to voluntarily participate in our pilot program. The unit manager and or the charge nurse will be responsible for ensuring that all nurses are complying with the program and provide support as needed. The program will be able to track the nurses' use of the Give Help tool. All nurses will be educated about the tool, including the ability to track the use 1 or 2 weeks prior to the implementation. The unit manager will survey patients during daily rounds to make sure that the patients have received the Give Help tool and will rate whether it was useful or not. Upon discharge, the patient will receive a survey to evaluate the tool. Make sure that this tool was helpful.
Now that we have discussed the movement phase, we will move on into the refreezing stage. At this point, we have proven that this tool will bring more benefits to the organization. So we have decided to make it a permanent change. In order to implement it, we will have to roll out a system-wide upgrade with the Give Help tool integrated into the computers. We will also give documentation instructions, and the nurse is given a 3-month period to use the Give Help tool at least 80% of the time, and 6 months to use the tool 99% of the time. Policy will indicate how is to be documented. Those with the highest compliance will publicly recognize through the entire hospital, we recognize through the entire hospital that they have achieved 100% use of the Give Help tool. Reteaching will be provided yearly.
Okay, Miss Clapp, this is Paula. She's gonna be your night nurse.
Hi, Paul.
So we're gonna do a bedside report right here so you can hear what we have to say, and if you have any question, just ask Paula or I will be able to answer it. So Miss Clark had a bowel obstruction. She is due for a CAT scan with contrast, so she's scheduled to be on NPO. So, do you have any question?
No, I think you gave me the communication tool. I know I don't have to eat for 12 hours, and I have a little blockage in my bowel, so I can't really go to the restroom until it's all fixed.
Okay.
Okay, and I'm going to go ahead and give you an updated one. It has all the new information, all the new, like that new doctor that came in to see you. It has his name here, and also we're going to continue on that NPO, the no eating. And also it's going to include all the information we had before about the NPO and the blockage. And let me just update our chart.
Hi, Mom. Yes, I'm doing better. They talked to me. They handed me this communication tool that actually has all my diagnoses. So I have a bowel obstruction, and I'm not supposed to eat anything for 12 hours, which I'm NPO. We'll be going for a contrast to visualize where the obstruction is located, and they will discharge me once everything goes smoothly. Yes, I'll be home soon. Love you. Bye.